I get asked a lot what is the difference between acupuncture and dry needling, because as to someone who doesn't know, they may seem pretty similar. So let me explain. Both use fine needles that penetrate into the body, and that's pretty much where the similarities end. I'll start with acupuncture. This treatment is thousands of years old. It uses predetermined points all over the body. There are around 400 of them, although most acupuncturists will use less than 50 points regularly. Each treatment will involve using from a couple to maybe more than 10 of these points, and they're chosen based on an assessment of the client where the person's whole health picture is taken into account, and a diagnosis is formulated that is normally the root cause for all the issues they're complaining of. These problems could be insomnia, infertility, high blood pressure, IBS, most health issues really. How does it work? Well, the needles stimulate nerves in the body that send signals to the brain and essentially remodulates how it functions. One of the most important areas that we know that it affects is the hypothalamus, which basically controls the stress response, the immune response, and the hormones, which are the systems that are most likely imbalanced with most ill health conditions. Although we can explain how it works, to apply it properly, you need to do the diagnosis and treatment within a Chinese medicine system, as we still can't explain why certain points affect the brain in the way that they do, and how to utilise them effectively any other way. It's normally quite a relaxing treatment, and many clients pretty much fall asleep during the treatment. Dry needling is a way of treating trigger points, or knots in the muscle, with the needles being used to go directly into the trigger point and release or deactivate it. Trigger points are small hypercontracted areas of muscle and are probably the main cause of musculoskeletal pain. They tend to refer pain to different areas away from the site of the trigger point, and as well as causing pain, they inhibit muscles, making them feel weak, and shorten muscles, making them feel tight. When a needle goes into the trigger point, you often get a twitch, which isn't the nicest sensation in the world, but as far as we understand, it's disrupting the overfiring motor end plates, and that causes them to relax. The other thing that it does is cause more blood flow and therefore oxygen to the area, which is lacking due to the muscle tension constricting blood flow to that area. There is absolutely no chance that you will fall asleep during this treatment, and you will feel a little beaten up for about 24 hours, but in conjunction with some good rehab and advice, is a great way of treating musculoskeletal issues.